friends, welcome to Easy Nurse, where nursing education made easy. So again, we are welcoming you people in our Lakshya 3.0 series. It's a brainstorming sessions for your upcoming exam. So mainly in these sessions, we are going to discuss regarding the adult health nursing 2, and it is related under BSc 4th semester. So students, don't worry, we are listeners here for supporting you and then guiding you. So let's start about today's sessions, and in these sessions we are going to give in most important topic as well as some more important MCQs. Okay, so let's start about today's session. So first come to the multiple choice questions or the MCQ. So here is the first questions. The most common cause of the myocardial infarction is, these are your options, and the answer goes to option B, that is coronary thrombosis. Next is the which diagnostic test confirms the presence of myocardial infarction. So these are your options, and the answer goes to option C, that is cardiac enzyme test as well as troponin. Next is the characteristic features of a left-sided heart failure is, these are your options, and the answer goes to option C, pulmonary congestions. Next, the first step in management of a patient with a chest pain is, these are your option, and the answer goes to option C, access the airway, breathing and circulation. Next, the main electrolyte disturbance in the renal failure is, these are your options, and the answer goes to option B, that is hyperkalemia, means the calcium level when it's increased in a circulation system, so that time it's known as a hyperkalemia. Next is the normal range of the serum creatinine is, these all are the option, and the answer goes to option B, 0.6 to 1.2 mg per dl. Now come to the next, in the COPD, the characteristic features is, these all are the option, and the answer is option B, that increase the airway resistance. Which oxygen delivery device provides the most accurate oxygen concentration? So these all are the options, and the answer is option C, that is Venturi mask. So through the Venturi mask, we have to supply the oxygen from the oxygen cylinder to the patient. Okay. Next one is the most common symptom of a peptic ulcer disease is, these all are the option, and the answer goes to option B, that is epigastric pain, which is relieved by the food. Next, which diet is recommended in the liver cirrhosis with ascites? So for these two conditions, which is the most preferable diet plan? These all are the option, and the answer is option B, that is low protein and low sodium. Next is, which of the following is a sign of a hypoglycemia? These all are the option, and the answer is option C, that is sweating and then tremors. Next one is the definitive treatment of appendicitis, means the infection and the inflammations of appendix. So what is the definitive treatment? These all are the option, and the answer goes to option B, that is appendectomy, means we have to cut or make an incision in that particular area, and we have to remove some total part of an appendix. So that is called appendectomy. Now come to the next, the nursing intervention is appropriate for a patient after thyroidectomy. So these all are the option, and the answer goes to option C, that is monitor for the tetany. Okay. Next question is, a patient with a hypertension should be advised to, these all are the option, and the answer goes to option C, that is reduce stress and exercise regularly. Next, the main goal in nursing care of a burn patient during the first 24 hours is, these all are the option, and the answer goes to option C, that is maintain airway and then fluid balance. So you have to remember, for the burn patient, the fluid calculation level should be done by the Parkland formula. Okay, so based on the TBSA or total body surface area, based on that we have to calculate the fluid. Okay, so what is the equation that I'll discuss later? So mainly you have to remember, like 50% of total volume of fluid we have to give in within 2 hours, and next we have to circulate day by hourly basis, like 4 hourly or 8 hourly. Okay, so this is the main principles of a Perkline formula for the fluid calculation. So now we move to the important topics for the adult health nursing. Okay, so first is a epistaxis. So what is the meaning of epistaxis? It's nothing but it's a nose bleeding. So it is not a disease but a symptoms. Okay, and its a prevalence varies between 10 to 12% cases. So what is the causes? First is local cause and systematic cause. Local cause in that sense trauma, sometimes infection, sometimes neoplastic conditions, and sometimes septal conditions. Septal conditions in the sense like a nasal septal deviations, etc. Now come to the systematic cause, like blood disorder, congenital cause, drugs, and endocrine disorders. Now come to the types of epistaxis. So what are the types? First is spontaneous epistaxis, means suppose like monthly wise or 1 and 2 month gap wise the epistaxis is happening for the patient, so that time it's called as a spontaneous. And hypertensive epistaxis is nothing but if nose bleeding is happening only for the reason is high blood pressure, so for that it's called as a hypertensive epistaxis. So what is the investigation? Blood test, hemoglobin test, TVC. TVC is nothing but tuberculosis verrucosus, which is a type of a skin test, in infection test specially for the tuberculosis, and they are checking the viral load under the subcutaneous layer. Now come to the DLC. So DLC is nothing but differentiate leukocyte count, which is measured the percentage of a leukocyte, and then bleeding time, clotting time, and PBF. Now come to the prothrombin time, thromboplastin generation test, biochemical test, blood sugar test, as well as the liver function test. Next is the initial first aid measures. So what is the initial first aid measures? First is positioning. So we have to give a patient in a proper comfortable position, especially the lean forward slightly, and then we have to pinch the nostrils, pinch the soft part of the nostrils, just blow the nasal bone and togetherly firmly at least 5 to 10 minutes without releasing. Next is the breathing. Encourage the patient to breathe through their mouth, and last is the cold compress. Okay, so these all are the initial first aid measures. Now come to the surgical treatment. First is submucous resection or ASMR if bleeding is firm behind a septal spot, and next the ligations of a ethmoidal arteria via the medial orbit, means if the bleeding is too severe at that time, then ligation of a external carotid artery, then angiography and vessel embolizations may be necessary in rare cases of patients bleeding, and next is the nasal packing. So these all are the surgical treatments specially, but it is a very rare case. Now come to the deafness. So deafness is nothing but inability to hear or listen to understand. So there are several types of hearing loss is there. First is mixed hearing loss, central or functional hearing loss, conductive hearing loss, and then sensorineural hearing loss. So one by one see. First is conductive hearing loss. So it's nothing but it is occurs in the outer layer as well as the inner layer and middle layer of ear and impairs the sound being conducted from the outer to the inner ear. Okay, so what is the causes? Impacted cerumen, sometimes foreign body accumulations, middle ear disease, osteosclerosis, then stenosis of the external auditory canal, as well as otitis media. So if you want to know detail about each and every causes, then go to the easiness applications and see the classes. Okay, next one is the sensorineural hearing loss. So in this it is caused by the impairment of functions of an inner ear or the vestibulococcal nerve, means cranial nerve 8. So vestibulocochlear nerve is also known as a cranial nerve atom. And next is the causes: congenital and then hereditary factors, noise, trauma, systematic disease like tuberculosis, syphilis, immune disease, diabetes mellitus, bacterial meningitis, and trauma. Next is the mixed hearing loss. So in this it is caused by combinations of a conductive as well as the sensorineural causes. Next is the central and functional hearing loss. So it is mainly caused by a problem along with a pathway from the inner ear to the auditory region of the brain or to the brain itself. Okay, so now come to the next, that is classification. So based on the decibel there are several classification is there. See, for the normal hearing, that is 0 to 15 decibel. Mild impairment means 16 to 25 55 decibel, moderate 41 to 55 decibel. For the moderately severe, like 41 to 55 decibel, and for severely impaired means 71 to 90 decibel. Okay, so these all are the classification. Now come to the next, that is clinical manifestation. So first, no responding when speaking others, then their straining to the ear, difficulty to communicate, inability to hear, as suspicion, loss of the self-esteem. Now come to the next, that is diagnostic evaluation. So first is history collection, physical examination, and then otoscopy, audiometry, as well as the tympanometry. So if you want to know about details about those things, what is otoscopy, how to do, what to use, and same way audiometry and then like tympanometry, then you go to the easiness application. Now come to the management. So what is the management? Like hearing aid is nothing but it's kind of the prosthesis. So one machine they're putting inside of ear as well as the behind of ear or outside of the ear, so which will be help the patients to understand and to listen. Next is the lip reading, means the hearing who can't able to hear, so they are trying to focus on your lips to read what you are saying. Okay, next is the sign language, cochlear implantations, assistive learning device as like a prosthesis as I said, and next is the hearing guided dogs. Okay, so these all are the management. Now come to the next, that is nursing management. So first is the pain management, next is symptom management. So we have to treat the symptoms such as the nasal congestion, sore throat, earache, cough with appropriate information, which is including the decongestant, antihistamine or the cough suppressant. And positioning is nothing but we have to keep the patient promote in comfort and drainage. So for the ear disorder, keeping the head elevated can help the relief patient. For the nasal congestion and elevated head positions while sleeping can be beneficial. Same way hydration and nutrition and then infection control. Now come to the next, that is retinal detachment. That is also one of the most important topic for your upcoming exam. So retinal detachment is nothing but when the retina is going to separate from the sensory area of the like rods and cone cells from the retinal pigment cells, so that time it's called as a retinal detachment. Okay, so it's nothing but separation of a sensory area of retina like rod cell and cone cell from the retinal pigment epithelium and then choroid, so that time it's called as a retinal detachment. Normally these two layers will are attached to each other with a potential space in between. Okay, so what are the types? First is exudative retinal detachment, tractional retinal detachment, and then ligamentous retinal detachment. For details, go to the easiness classes application. Now come to the clinical manifestation. First is visual fluid loss, then decrease the IOP. IOP is nothing but intraocular pressure. Next is heaviness of the eye, blurred vision, and then dark spot. What are the etiology? Eye trauma, aging, high myopia, aphakia. Aphakia is nothing but absence of a lens, then diabetic retinopathy, and then vitreous hemorrhage. Now come to the diagnostic evaluation. So what is the diagnostic evaluation? First is ophthalmoscopy. So through the proper light and torch, we have to see inside of our eye. Next one is the slit lamp examination. So mainly it's kind of the lamp light, so which is helpful the doctors to examine inside of the eye, especially the retina and how it's present inside of our eyes. Now come to the Goldman 3 mirror examination. So parallelly 3 mirrors should be present, and they are creating an image through the slit lamp or through any other technical method, so it will be visible on the mirror, and based on that they will take the decisions. Okay, now come to the medical management, anti-VEGF agent, steroid, osmotic agent, and NSAIDs. So if you want to know the example and the details about the medical management, then go to the applications. Now come to the surgical management, that is photocoagulation, cryosurgery, electrical diathermy, vitrectomy, scleral bunking, as well as the pneumatic retinopexy. So these all are about surgical management. So for more details, follow easiness. Now come to the next, that is glaucoma. So glaucoma is also one of the most important topic. Glaucoma is nothing but it is a multiple disorder which is characterized by an abnormally high IOP or the intraocular pressure, optic nerve dystrophy, and then peripheral visual field loss. Okay, so that is the three characteristics in added together it is present inside of a patient eye, so that time it's called as a glaucoma. What all are the causes? Aging, genetics, eye trauma, hypertension, severe myopia, ocular surgery, black ethnicity, diabetes mellitus, migraine headache, extreme dilation of pupil, degenerative changes in the trabecular meshwork, and then prolonged use of a local or systematic corticosteroid. So what are the types? First is congenital and second one is acquired. So in the congenital, true congenital glaucoma, infantile glaucoma, as well as the juvenile glaucoma. So true congenital glaucoma is nothing but from the birth itself it is present for the baby. Next is infantile, means after the birth within 1 week to 28 days the patient or the baby got the glaucoma. And next is the juvenile glaucoma. Juvenile glaucoma is nothing but when the baby sent it by the family into the child labor management. So in that, due to this heavy lifting or due to some another pressure work based on their age, the IOP is going to increase, and then another characteristics are also coming inside of the eyes. So that time it's called as a juvenile glaucoma, means before 18 hours due to the child labor, if the glaucoma is diagnosed for that particular child, so that time it's called as a juvenile glaucoma. Now come to the next, that is acquired. So for the acquired, primary and secondary. So primary, under this primary open angle glaucoma, means that is the trabecular meshwork, okay, and this is the ocular prosthesis. So if the the angle in between this two layer is increasing more than 45 degree, so that time it's called as a primary open angle glaucoma. And if the angle is less than 25 to 35 degree or the percentage, so that time it's called as a primary angle closure glaucoma. Now come the diagnosis, that is clinical assessment, ophthalmoscopy, tonometry, gonioscopy, perimetry and slit lamp examination. So for more details follow the easiness applications. Now come to the next, that is medical management. So what is the medical management? First is the beta adrenergic blockers, then cholinergic blockers, carbonic anhydrase, then carbonic anhydrase again means part 2. Next is the prostaglandin analogs, and last is the osmotic agent. So what all are the surgical management? First is argon laser trabeculostomy, next is the laser iridotomy, and next one is the cyclocryotherapy, and fourth one is the cyclodialysis, and last one is the filtering procedure. So these all are about surgical management for the glaucoma. So for more details and to get the procedures, go to the easiness applications. Now come to the next, that is formations of a urine. So mainly in our body, urine is one of the object which is carrying the unused objects from our body, which is situated inside of our circulation system, and also it's produced by the food which is no use, actually not usable things, right? So that is called urine. So in a liquid formation while it is passing from our body. So how this urine is going to formulate, so that we have to see. So mainly this urine formation is related with our central nervous system. Okay, so from the central nervous system, how it's going on? First is filtration. So filtration is nothing but like blood enters the glomerulus in the nephrons, means from the signals of the brain, then it's come to the renal system. Okay, so from the renal system it's going on. So that's why the formation of a urine is completely connected through the central nervous system, then come to the renal system, then only the urine formation will go on. So first is the filtration. Filtration is nothing but when the blood enters into the glomerulus of a nephron, then water, ions and then small molecules, they are filtered into the Bowman's capsule and forming the filtrate. Okay, so after filtration what is happening? Reabsorption. So essential substance like glucose, then amino acid and water, they are reabsorbed from the filtrate back into the blood as it passes through the proximal converted tubule, loop of Henle, and then distal converted tubule. Next is the secretion. So additional waste product and excess ion, they are secreted from the blood into the tubular fluid into the distal convoluted tubule and collecting duct. So after secretion what is happened? Concentration. So the collecting duct, they further concentrate the urine by reabsorbing more water, especially under the influence of antidiuretic hormone, means through the ADH hormone. So after secretion and after increasing the concentrations in the tubular area, ADH hormone is releasing in this particular factor, and then only it's coming and influencing for more concentration. Next is the excretion. The final urine is transported from the collecting ducts to the renal pelvis, then to the ureters, and finally it is stored in the bladder until it's expelled through the urethra. So these all are the process of formation of a urine. So mainly there are 5 processes. First is filtration, then reabsorption, then secretion, concentration and excretion. So while you are going to write this formation of urine, then you have to remember some words, that is Bowman's capsule, which is mainly using for the filtration. Next is the convoluted tubule, loops of Henle, and then distal convoluted tubule. So these 3 words is related with the reabsorption, and for the secretions only you have to mind, that is tubular formations. Okay, and for concentration also tubular duct, and excretion also tubular duct. Okay, so these all are the parts which is related for the formation of urine mainly. Okay. Now come to the next, that is glomerulonephritis. So glomerulonephritis is nothing but it is a type of a kidney disease which is mainly characterized by inflammations of a glomeruli, which are the teeny filters in the kidney which remove the waste as well as the excess fluid from the blood. So glomerulonephritis, when the inflammations of a glomeruli is happening inside of our kidney, which is mainly they are not working properly by removing the waste product as well as excessive fluid from the blood. So that time it's called as a glomerulonephritis. So what are the types? First is acute glomerulonephritis. So in this, its type occurs suddenly, often following an infection such as a strep throat, and it's also characterized by rapid onset of the symptoms like hematuria, proteinuria, and then hypertension. Hematuria in the sense blood in urine, proteinuria when protein excretion happens through the urine, and then hypertension or the high blood pressure. Now come to the chronic glomerulonephritis. So it's developed slowly over several years, and it can lead to the gradual loss of kidney function, and often presenting with the symptoms like proteinuria, hematuria and hypertension over a long period. So what all are the causes? Like infections, bacterial infection like streptococcal throat infection, viral infections like hepatitis B, C, as well as parasitic infection. Next come to the immune disease. So in this, conditions such as lupus and then good Pasteur syndrome. Next is the vasculitis, inflammations of a blood vessels like in polyarteritis nodosa as well as the granulomatosis with a polyangiitis. Now other conditions like diabetes, hypertension as well as amyloidosis. So these all are the causes for the glomerulonephritis. Now come to the management. So come to the medications. So prescribing the anti-inflammatory drugs like immunosuppressions or the antibiotic if infection is present. Blood pressure control, use the ACE inhibitor, ARBs or other antihypertensive drugs. For the dietary changes, we have to advise for reducing the salt intake, protein intake and fluid taken to lessen kidney workload. Next is the diuretics, managing the fluid retention and swelling. Then treating the underlying conditions like assessing the root cause such as autoimmune disease or infection. Next is the dialysis in severe case for performing the kidneys filtering functions, and then monitoring regular follow-up for track the kidney function and adjust the treatment as needed. So now come to the hemodialysis. So hemodialysis is a medical procedure which filters the waste, excess the fluid and toxin from the blood when the kidneys are no longer able to perform these functions adequately. Okay, so what are the purposes? First is waste removal. So eliminate the waste product from the bloodstream. Fluid balance, maintain the proper fluid levels in the body. Then electrolyte management, like regulate the electrolyte level. Acid base balance, like maintain the proper pH level in the blood. And symptoms relief, like alleviate the symptoms associated with a kidney failure such as the nausea and fatigue. What is the precautionary measures? First is vascular access care. So in this we have to maintain properly, and we have to maintain the hygienic of a vascular access site for prevention of infection. Next is diet and fluid restrictions. So we have to adhering the dietary guidelines and also the fluid intake restrictions. Then medication management, we have to take in the prescribed medications based on physician order as directed and informed by the healthcare workers. Next is the regular monitoring, like regular blood tests test and then health monitor for assessing the treatment efficiency and then adjust the parameters. Next is infection control. So use the sterile technique and monitoring for signs of infections. Blood pressure management. Regularly we have to checking the blood pressure for avoid the complications during and after treatment. Okay. Now come to the next, that is epididymis. So epididymitis is nothing but that is also inflammations of epididymis which is caused by the infections or the non-infectious cause, which is characterized by the scrotum or the groin pain and swelling, pus and bacteria in the urine and then fever and chills. So epididymis is nothing but inflammations of epididymis. It's a tightly coiled tube at the back of each testicle that stores sperms while they mature. Now come to the next, that is causes. STI, bacterial infections of urinary tract, urine in epididymis, tuberculosis and trauma. Then what all are the risk factors? Sex with a partner having STI, sex without condoms, a history of the STI, having prostate or urinary tract infections, uncircumcised penis, then having a medical procedure done which affect the urinary tract such as insertion of urinary catheter or the scope into the penis, and HIV or AIDS. Now come to the clinical manifestation, that is swollen and discolored or warm scrotum, pain while passing the urine, discharge from the penis, blood in semen, then an urgent or the frequent needed to urinate, and then testicle pain and tenderness. Now come to the next, that is orchitis. So orchitis is defined as the inflammation of a testicle unilaterally or the bilaterally, usually caused by the virus or bacteria. So what are the risk factor? Autoimmune disease, bladder outlet obstruction such as benign prostatic hyperplasia, Foley catheter, multiple sex partner and then unprotected sex, and then previous episode of epididymitis. Now come to the causes. So orchitis in the young patients is usually viral, with mumps and then rubella being the most common cause, and other viruses include the coxsackie virus, then varicella, ecovirus as well as the cytomegalovirus. Next is bacterial infections of a prostate and urinary tract infection can cause a orchitis, and bacteria include E. coli, Klebsiella pneumonia as well as the staphylococcus. So what all are the types? First is bacterial. So in this, bacterial orchitis is associated with or the result of epididymis. Next is a viral. So in this, mumps virus usually causes the viral orchitis, and other types idiopathic orchitis, autoimmune orchitis. Now come to the clinical manifestation. So first is testicular swelling on or both sides, then testicular pain which is ranging from mild to severe, then tenderness in one or both testicle which may last for weeks, then nausea, then discharge from the penis, fever, then blood in semen and urine, pain while urinating, tender swollen groin area on affected side, and epididymis inflammation. So now come to the next, that is burn. So burn is also one of the most important topic for the exam. Okay, so burn is nothing but it's an injury to the skin or other tissue which are primarily caused by the heat, chemicals, electricity, radiations or the frictions, and this injury also can vary in severity and are categorized based on the depth and extent of tissue damage. Okay, so what are the types of burn? So there are several types based on the degree of burn, based on depth of damaged skin, and based on the cause. So based on the degree of burn means first degree burn on the superficial, which is involves only the outer layer of the skin or the epidermis layer. So what are the characteristics? Redness, minor inflammation, pain, dry skin without blisters, an example like a mild sunburn. Now come to the second degree burn. So it is a partial thickness. So what is happened? It involves the epidermis as well as the upper part of a dermis. So in this, the characteristics: red blistered skin that is heavy, painful, and may appear the wet or moist. And what is the example? Scald injury from the hot liquids. Okay, now come to the next, that is based on degree, that is third degree burn, or the full thickness involves in full thickness of the skin affecting both the epidermis as well as dermis completely, and characteristics: white lethargy or the charred appearance, may be numbed due to the nerve damage, and example prolonged exposure to the flames. Now come to the fourth degree. So fourth degree, it throughout the skin through underlying tissue such as muscle, tendon as well as bones are also might be affected. So what are the characteristics? That is charred appearance, usually painless due to the destructions of a nerve endings, and examples: severe electrical burns. Now come to the based on a damaged layer of the skin. So based on that, there are three types. First is superficial burn, partial thickness burn, full thickness burn. So in the superficial burn, skin layers is affected means epidermis, and for the partial thickness, epidermis and part of a dermis, and full thickness entire epidermis and dermis. So characteristics for the superficial burn: red dye, painful skin without blisters, and for the partial, red, blistered and very painful skin, and which may appear the wet or moist, and white lethargy or the charred appearance, which skin may be numb due to the nerve damage. For the healing time, within a week or without scarring for the superficial burn. For the partial thickness burn, in 2 to 3 weeks, potential for scarring and pigment changes, and full thickness burn, it requires the medical interventions for healing, often necessitating skin grafts and significant scarring. Example like mild sunburn. For the partial thickness, scald injury of the hot liquids, and full thickness burns from a prolonged exposure to the flame. So these all are the overview of based on damaged layer of the skin. So now come to the next, that is based on the cause of the burn. Okay, so two types, thermal burn and chemical burn. So in the thermal burn, what is the definition? It is caused by exposure to the heat source like as fire, hot liquid, steam, as well as the hot object. And for the chemical burn, result from a contact with a corrosive substance like acid, alkalides, as well as a solvent. So skin layers affected. So for the thermal burn, it can range superficial to full thickness burns depending on the duration and the intensity of the exposure. And for the chemical burn, it can cause various degrees of a burns depending on the chemical's concentration and duration of a contact. Now come to the example: burns from touching a hot stove, and burns from industrial chemicals or household cleaning. Now come to the based on cause of the burns, two more: electrical burns as well as the radiation burn. So definition: electrical burn, it's caused by the electrical current passing through the body, and radiation burn is nothing but when result from exposure to the radiation such as ultraviolet radiation or any ionizing radiation. So which skin layer is going to affect? For the electrical burns, often deep, potentially affecting all the skin layers and underlying tissue or tendons also. And for the radiation burn, it can vary from the superficial to the full thickness burns. Okay, so now come to the next, that is example. So burns from the touching live electrical wires, and sunburn or the burns from a radiation therapy. So now come to the next, that is based on the cause of the burn. So that is friction burn. So definition is nothing but caused by the skin rubbing against a rough surface, which is generating the heat and causing damage. So skin layer damage like typically superficial but can extend deeper with a prolonged or intense friction. So example like road crash from a motorcycle accident. Okay, so these all are about based on cause of the burn. Now come to the next, that is calculation of a burn, and that is the most important topic for the burn section. So first is the burn calculation, which is estimating the TBSA or total body surface area. Okay, so in this first is rules of 9. So you have to study this very sincerely, because sometimes they are asking in a 5 marks question, or sometimes they are asking in a 2 marks question. So what is the rules of 9? So when in this case we have to divide the body in a section which presenting the 9% or a multiple thereof the TBSA. Head and neck going to the 9%, each arm 9%, 4.5% for anterior surface, 4.5% for the posterior surface, each leg 18%, 9% for anterior and 9% for the posterior. Anterior trunk 18%, posterior trunk also 18%, and perineum 1%. So this is the calculations for a rules of 9 based on the adult. Okay, example, if a patient had burns entire right arm and then anterior trunk and then anterior thigh leg, so for that what should be the calculation? See, here they mention the right arm, anterior trunk and then anterior right leg. So for each and every arm we know 9% is right. So for this right arm it should be 9%, anterior trunk they mention means 18%, and to right anterior leg means 9%. So total TBSA means a 9%, 18% plus 9%, total 36%. So based on that we have to calculate the TBSA or total body surface area for a burn patient, and based on that we have to select the fluid calculations. Okay, so now come to the next method for the calculation, that is learned border chart. So what is the learned border chart? It's a detailed and accurate accurate method for establishing the total body surface area which is affected by the burns. So this chart it's account for variations in body surface area due to age, making it particularly useful for children as well as the adults. Okay, so in this chart mainly divides the body into the multiple section, each with a assigned percentage that differ based on the age of a patient. So the percentage are higher for areas of body that is proportionally larger in the children compared to the adult. So based on the children and adult, based on the proportionate of a area of that particular burn, that we have to affect on this particular land border chart, and based on that we have to calculate. So head and neck is higher percentage in infant and child due to the proportionally larger head size. So suppose for the adult, if it is 9%, means for the children it should be counted as a 18%. Now come to the each arm, it's fairly consistent across all age groups. Next is a each leg, that is lower percentage in infants and children due to the proportionally the shorter leg. And next one is the anterior trunk, which is fairly consistent across all over the age group. And then posterior trunk burns. Okay, so what is the scenario? See the scenario first. The burns on entire head. Entire head means head and neck. Next is the anterior trunk and the anterior surface of the both legs. So these they all mentioned whichever part is have burned for that particular 5-year-old child. Okay, so now come to the steps. Means we have to know the calculation first. So for head and neck, they are percentage is according to the land border chart, that is 12%. For anterior trunk it is 18%. And for the anterior surface of the both legs, that is 8.25% each leg. So 8.25% into 2 is equal to 16.5%. So both legs means 16.5%. If they mention in one leg, so it should be around 8.25%. Okay, so these all are the methods according to the land border chart. So now head and neck, see the scenario, and based on that we have to put the ratio. Head and neck 12%, each arm 9%, means 4.5% front and 4.5% back. Each leg 16.5%, 8.25% in front area and 8.25% in back area. Anterior trunk 18%, posterior trunk 18%, and perineum 1%. So total TBSA burn based on this scenario, that is 12%, because they mentioned the entire head. So head and neck is equal to 12%, right? So 12% head and neck plus anterior trunk. Anterior trunk means the ratio should come 18%, and then anterior surface of a both legs means 8.25% for each legs, means 2 into 2. So total 16.5%, right? So total TBSA is equal to 12% plus 18% plus 16.5%. Total 46.5%. So total TBSA according to the land bounded method is 46.5%. Now come to the advantage. So what is advantage? First is accuracy. So it's mainly provided more precious estimations of a TBSA for the burn patient, especially in the children. So age specific is nothing but it's adjust for the difference in body proportions which is across the various age groups. Next is the detail. So breaks down the body into the smaller regions for their assessment. Okay. So now come to the next, that is calculations of a burn. So next one more method, that is Palmer method. So it's useful mainly for using the small burn method or the irregular shape burn. So the patient one hand or the one approximately like holding as a 1% of their TBSA. Okay, so see the Palmer method. 1 palm means 1%. If it is covered, complete palm. So if it is covered only this palm portion except the finger, so it calculates 0.5%. Now if the means larger palm is completely covered that particular patient burn area, so it calculates as a 0.8%. And in the larger hand, if it is covered only the palm area except the finger, so that time it's considered as a 0.5%. Okay, so example, if a burn area is roughly the size of 5 palm areas, so total TBSA is 5%. Now come to the fluid calculation. So that is the Parkland formula. So for this we have to know first the equation of to calculate the fluid volume. So in this, first is 4 ml into the body weight in kg and into TBSM means percentage, total body weight, total body surface area, how much percentage it is burned. Okay, so first we have to administer half of the calculate volume of that particular volume in first 8 hours, and then we have to administer the remaining within next 16 hours. Okay, so see, fluid restriction is guided by the formula such as Parkland formula. So example, for a 70 kg patient with a 36% TBSA burns. So fluid volume, how much should be the fluid volume? 4 ml into the 70 kg and into 36, because percentage of TBS is 36, right? So total fluid volume should be 10,080 ml or 10.08 liter. So first 8 hours we have to circulate the 5040 milliliter or 5.04 liter, and within next 16 hours we have to circulate 5040 ml or 5.404 liter. Okay, so now come to the next, that is reconstructive surgery. So what is the meaning of reconstructive surgery? It's nothing but it's also known as a cosmetic surgery. Okay, so which is mainly encompasses a wide range of a procedure which is improving the function and then appearance. Below its detailed descriptions in various type of a surgical method. Okay, so first is a initial burn treatment. So for the debridement means removal of a dead tissue through the tooth forceps. Okay, now come to the skin grafting. Skin grafting is nothing but sometimes the doctors, they're cutting the skin or the layers from the thighs and they are placing that particular skin on the affected area. So that is called skin grafting. Then temporary skin substitutes like a addition tape. Now come to the secondary. So for that scare revisions, how like cosmetic like a cosmetic surgery and etc. Next come to the tissue expansion. So from the breast, especially for the women, they are taking the tissue and they're replacing over there. Next is the flap surgery. Okay, so flap surgery is nothing but from other part they are taking that particular area, skins and like debridement, everything, and they're placing over there. Okay, so these all are the secondary reconstruction. So now come to the next important topic, that is HIV or the AIDS. So what is this? The human human immunodeficiency virus or HIV. It is an infection which attacks the body's immune system. Means it is an autoimmune disorder which is acute immunodeficiency syndrome, is the most advanced stages of disease according to the WHO. So it is a retrovirus. Its genetic material is carried in the form of RNA rather than DNA. Okay, so in the epidemiology and the disease, so who reports the states that 38 million people in the world they're living with at the end of the 2019, and in India 2.14 million cases is present for the HIV. So how it's going to transmit it from one person to another person? First is unprotected sex like anal, vaginal or oral sex, sharing the infected needles for the injecting drugs, then occupational exposure, injections of a contaminated blood, as a example healthcare workers is accidentally picked with an HIV contaminated needle, then using the infected instrument, maternal transmission like transmission from an infected mother to the child before birth, during birth or after birth, then medical procedure like transfusion of the blood that contaminated with HIV, organ transplantation. Okay, so these all are the transmission of a HIV. Now come to the clinical manifestations of a HIV. So for the stage 1, that is asymptomatic and like persistent generalized lymphadenopathy. Next is the stage 2. So in that the symptoms are nothing but unexplained moderate weight loss, recurrent respiratory tract infections and oral infections, fungal nail infections, and then seborrheic dermatitis. Next is stage 3, that is unexplained weight loss and persistent fever, oral candidiasis, then severe bacterial infections, unexplained anemia and pulmonary tuberculosis. In the stage 4, that is HIV wasting syndrome, pneumocystic pneumonia, recurrent severe bacterial pneumonia, chronic herpes simplex infection, esophageal candidiasis, HIV encephalopathy, lymphoma, extratubular tuberculosis, recurrent septicemia, symptomatic HIV like associated nephropathy, and then cardiomyopathy and invasive cardinal carcinoma. Okay, now come to the diagnostic evaluation. So for that HIV status, any opportunistic infections, any complications, status of a family members or counseling and medical care, Chief complements is nothing but signs and symptoms and reason for a hospitalized. The significant recent medical history. So in that we have to see history of the disease like malaria, tuberculosis, STD or the other diseases. Next one is the relevant sexual history. So in the sexual partners like multiple sex partner or one partner, the sexual practice as well as use of the contraceptives. Okay, now come to the antiretroviral therapy. So this is also one of the most important. You have to know the medicine name. Okay, so first is nucleoside reverse transcriptase inhibitor. Now come to the clinical utilities room. So in this, the dedicated space for storing the sterile and equipment or the supplies and ensuring that everything is readily available for the patient care. Next is soil utilities room, means the contaminated area or contaminated things they should be kept, and then reducing the risk of infection. Then single rooms, it's a very to prevent the cross infection, as well as private room which is proper equipment and then comfortable. Now come to the next, that is the storage room. So generate storage area for additional medical equipment and supplies. Bathrooms, accessible private bathrooms for the patient, designed to be hygienic as well as easily cleaned. Next is a pantries cleaner, that small area of a preparing and cleaning the food items, ensuring the patients have access to the fresh and hygienic meals. Then conference room, the space for the medical staff for conduct the meeting, discuss the patient cases, and then participate in a training sessions. Office and interview room, private office room for administering the task and confidential patient for the family consultations. Then staff facility, lounge and then rest area for staff to take the breaks, reducing the fatigue and promoting the well-being. And then relatives waiting area, so in that it is a private area for the family members to wait, to revisit, as well as to sitting and for the during the visiting hours. Okay, so thank you. I hope you all understood my session. So in this session I discussed so many important topics. Rather than that, you have to know the central nervous system, that unit, as well as like some another important units are there. From there I can't give some like specifically important topics. Okay, that these chapters are very much important, so each and everything you have to study about that. Okay, and I hope and all the best for your upcoming exam. And if you want to know more updations and if you want to update your skills in our nursing professions, then stay tuned with the Easy Nurse. Thank you.